Welcome, everybody. Welcome, fellow conservatives, fellow patriots. Those are the nice ways to say it. If you want to say it the way the left says it, say Hillary, she would say, welcome, fellow deplorables, you rock dwellers. Obama would call us bitter clinger-oners, or just bad people. Biden would tell us that we're chumps. And other Democratic leaders have called us squealing pigs, hostage takers, terrorists, saboteurs, arsonists, you name it. They have all kinds of names for us. But interestingly, rarely is it fellow American or something like that. It's always something kind of, mean-spirited. But supposedly we're the mean people, right? We know that's not the case, though. We are, in fact, proud Americans. We're patriots. We're conservatives. So we're glad you're here with us. I'm George Landreth. He is Dr. Nasser Sheikh, the good doctor, the doctor of our republic. So it's always great to be with you, Nasser. I'm so glad that we get to do this. It's a lot of fun. And I have to say, I love your backdrop. I love your optimism. I like the way you approach liberty. I can tell that it means something to you.
Well, thank you, George. And all those words that the Democrats utilize and the leftists, that's all done in the sake of unity, correct?
Oh, yeah, love and unity.
Unifying. Yeah, that's just unbelievable how that much unifies us all. But you know what? Guess what does unify us? This great country, which behind me is this backdrop of the symbol, because it's just another great day to be alive and well and free and living in the United States of America, the greatest country in the history of the world. And we've got a lot of things going on in the political landscape out there, George. Obviously, it seems that I have a lot of people, you look on Twitter feed and you're looking on your social media platforms and you're seeing a lot of conservatives and people that are out there, the 72, 73 million plus, Trump voters. And you see some of the things that, there's a lot of despondency, and then you have your ups and downs. You hear that, one court said yes, and another court, struck three things down. So we want to get into a little bit of good news that happened actually on Friday, and that was that what happened is that this is an order that was made through the Chief Justice and the Associate Justice of the Court, and this is pursuant to Title 28 of the United States Code, Section 42, and that this is effective as of November 20th, 2020. And what they did was that they redistricted the court. There are the 11th Circuit Court of Appeals in America, and each of them get assigned a Supreme Court justice. And so this was all done on Friday in the morning, and we're going to go into that a little bit. But before we do, George, could you sort of let our audience, know exactly, for example, that when you lose a case at the federal level, and like, for example, we are hearing, for example, that President Trump, they've lost some of these cases to federal judges. And in one of the things, I think Rudy Giuliani said we really were, not that we accepted the decision, but we were at least happy in the fact that the Obama-appointed judge, struck us down immediately rather than letting this carry on, because now we can take the next step. So give our viewers and listeners out there, what does it take for when you do bring something and take it to court, that move the steps up till you get to the Supreme Court, and then we'll get into why this could be a benefit for the Trump team and what this means going forward.
Absolutely. Well, for those who remember back to the 2000 situation, you have state courts are often typically your first line of defense because they're in charge. The state is in charge of the election process, and then what happens is if there's federal issues, things like equal protection, constitutional issues, which equal protection would be one, the idea that we all have a right to be protected under the law and have our vote counted, then of course the federal court can intervene at some point because these are important issues. It's not just a contract dispute between two people or something. So eventually you can go to the federal court, and it can work its way up. So you've got federal district court, you've got the federal appellate court, and those are done in circuits. And the circuits basically are they're just done geographically. So for example, the Ninth Circuit is Alaska, Arizona, California, Guam, Hawaii, Idaho, Oregon, Montana, Nevada, and Washington State, and I think there's also another island, Providence, I think the Mariana Islands or something. But at any rate, the 10th Circuit, again, is it's Utah, Wyoming, Oklahoma, New Mexico, and so they're just, grouped together, and you have all these different circuits, and you've got 11 circuits, plus you've got the Federal Circuit, which is deals with federal law issues, and there's also the D.C. Circuit again, and so you have these essentially 13 circuits, and so the 9 justices split them up, and they essentially supervise that circuit. And so That's, for example, if something comes from Pennsylvania, let's say something's being taken from Pennsylvania on up, it would be Justice Alito who would deal with that issue, because he is over the Third Circuit, which includes Delaware, New Jersey, Pennsylvania, and the Virgin Islands. So, and the Fourth Circuit is, is Maryland, North Carolina, South Carolina, Virginia, so forth. So, bottom line is Justice Alito would then be the first judge on the Supreme Court level to deal with something. He could give emergency orders, an emergency stay. He's done that already, where he has provided an emergency order telling Pennsylvania to preserve certain information so as to not to commingle ballots and make it so you can't later figure out which ones arrived late or which ones and so forth. So bottom line is that's the process. And then at some point, the whole Supreme Court would decide or make a vote on whether they want to hear a case. But if Justice Alito didn't want to hear the case, it might be harder to convince another 5 justices of the Supreme Court, since he's the one who's kind of watching it. They don't have to follow his view, but the fact is, in each case, the justice over that circuit is an important administrator over that circuit. So the good news is, in Pennsylvania, it's Justice Alito. Good news is, in Georgia, it would be Justice Thomas. So, those I think are, in Michigan, it's Brett Kavanaugh, because that's the Sixth Circuit. The Wisconsin, it's Amy Coney Barrett, who is over the Seventh Circuit, where she used to be a federal judge in the Seventh Circuit. So I think that's probably good news, because I think these are justices that are apt to follow the law and the Constitution.
No, you're absolutely right, and I think that's what makes it so great is that I didn't take a look and see who was assigned these previously, but the assignment has to go through, the Supreme Court Justice, John Roberts. But I'm sure that, not sure, but look, the way these things fell down and the way that these justices were allotted into their into the certain circuits, as you sort of mentioned, leads a person to believe that this is something that was formulated and well thought out of, right after the election, and maybe even prior to the election. I mean, when people are, you've got very, very smart people in the West Wing of the office that are, obviously planning all of these things here. If somebody told me that, somebody just thought of this, a couple of days ago, I think, well, that's very fortuitous and lucky, but I just don't think things like this work this way. I think there's a way of doing it. And my own personal thing is, and we sort of joke about this before, because obviously me being on the medical side of things, you being the attorney on your side of things, we always sort of joke and say we play each other on television or whatever. So I'm going to put on my lawyer hat, so to speak, a little bit. And we'll trade. You can have my MD hat for a while. But I think, and then let me know if you think this is a logical reasoning, is that I think the Trump team is hoping that this whole thing is going to be forced, I think, by what happened in Pennsylvania. Because the thing with Pennsylvania is that it is up to Article 1, Section 4 of the Constitution that says that the time, manner, and place of elections thereof are going to be relegated to the legislators. Not to the governor, not to Secretary of State, not to the lieutenant governor or any other political.
And the same thing in Georgia, because they had a consent decree that was entered into by the Secretary of their Secretary of State, I think they call them.
Correct.
And they don't have the authority to enter into an agreement that changes how elections are done, because the Constitution says, at least with respect to federal elections. For state elections, the federal government doesn't, play as big a role, obviously, other than questions of equal protection and so forth. But for federal elections, which the president's pretty sure, I think that's federal, House and Senate, I'm pretty sure those are federal. The Constitution outlines exactly who's in charge within each state, and the answer is the legislature, like you said, no one else. Not even the governor, quite frankly. So what that tells you is the legislature could just pass a resolution. They don't need the governor to sign it. Under the Constitution, for purposes of how the election will be played out and how votes will be counted and what the rules are, the legislature has the right to do that. Now, most states do get the governor to sign the bill and they make it a law, and that's fine. But and they may need that for the state elections that they hold. And maybe they want to use the same process for both, so they just do go through that nicety. But my point is, for federal government, you do not need the governor to agree. It's the state legislature.
Exactly, and you're talking about the consent decree. I mean, in Georgia, I believe that, you do need a voter, you do need to show ID to vote in person. But what happened was with these mail-in ballots, they said no signature verification was required, and that was done by this consent decree that they had done, with the Democratic Party and, and others, and Stacey Abrams, was leading that whole push in terms of that. So I think Justice Alito, they already intimated with the other four justices prior to, Amy Coney Barrett coming on the Supreme Court, is that they had already been intimating as to what was the ruling or what the thought processes were in Pennsylvania. That look, these laws were broken, and that's why you have these what we call our, hopefully when President Trump is, one of the things that he's looked at is that he's looking at these people as strict, constructionists, originalists, that they're basically not saying that's a living, breathing document that we can change it, for the times. They go to the intent of the framers of the Constitution. So I think that's the whole idea is that if they get a good ruling from Justice Alito to say, these votes that came in after 8 p.m. on November 3rd, they need to be completely thrown out. And then go into those counties where they were talking about that some votes were cured in the Democratic counties, meaning that they called those people in the Democratic counties, said, come on in, what you voted for, you did it wrong, you need to fix it. But that's not what happened with the counties that went red. So I have a feeling that if this domino falls in Pennsylvania, that could set the precedent, for the others, depending upon which place they go. And I think they set it up in that way. So, it's taken at each step at each federal level court, or circuit court, rather than going all the way up to Supreme Court, which it may end up finally. But at least the dominoes start to fall. And I know we're coming up against a break, but maybe we can pick that up and see if my reasoning is legal?
No, I think you're right on. I actually think you're right on.
All right.
But we are up against the brakes.
I'm playing the lawyer wasn't too bad there.
Yeah, you did well. Let's put it this way, though. If I'm going to play doctor, we could end up with a dead patient, so we shouldn't do that. But we are up against the break, so we better just go to our sponsors and make sure we conduct a little business here. But I do want to remind you can check out our website for a rebroadcast, ccrshow.com. Don't go away. The good doctor and I will return right after these messages.
Mom, thank God you're gonna be okay.
So relieved. But you both should know when my time comes, I have a final expense policy with Senior Care USA.
Is Senior Care USA the life insurance policy that helps loved ones pay for funeral expenses and other debts? Bill and I called to get more information.
Yes, and there's an immediate payout of up to $50,000.
If you're over 50, call Senior Care USA now to learn more about final expense insurance plans.
There's no medical exam, even if you have a pre-existing condition like I do. When I called, the quote was free, and there was no pressure.
I found out that policies start for as little as 35 cents a day. Rates will never increase and coverage won't decrease.
I'm gonna call today.
Ask about the free prescription discount card. Oh, I'm so glad you'll be taken care of.
Call 1-800-822-7419. That's 1-800-822-7419.
But is it? It's really just the beginning, right? Have you written a book and want it published but don't know where to start? You're not alone. Page Publishing cuts through the confusion that most new authors face, like copyright protection, barcodes, printing, and digital uploading. We will get your book into bookstores now. We guide you through the publishing maze and help you distribute and sell your work in hard copy and ebook formats. That's right. We will digitize and place your book for sale on Amazon, Apple iBooks, and Google, offering it to millions. Don't waste another minute. Most publishers won't even look at new author submissions, but we're different. We review your book and provide you feedback in about a week. If we decide to publish your book, your work ends and ours begins. From copy editing and proofing to typesetting and book cover art, our team gets you into bookstores fast.
Call 1-877-461-5033. Does your current bathroom need to be updated immediately? Introducing one-day bath and shower remodeling. The complete and hassle-free way to get the new bathroom of your dreams in as little as 1 day. And for as little as $199 a month. Yes, the experts at One Day Bath and Shower Remodeling will come to you anywhere in the country and show you all the customized options. Now you can have a brand new bathroom in as little as 1 day. Large or small bathrooms, if you want a new bathtub or shower installed, we can do it in as little as 1 day. And if you call right now, you can save $750 off your remodel. We make it easy by offering you financing as low as $199 per month. So for as little as $199 a month, you can finally have the bathroom of your dreams. Call now to schedule your free in-home consultation.
Welcome back to the Conservative Commandos, the radio show, the television show. Thanks to the AUN TV network, the Conservative Commandos radio network, Roku, our own website, ccrshow.com. And how is that possible? Because of Al Gore's amazing internet. I'm George Landreth with the good doctor of our republic, Dr. Nasser Sheikh. And we're glad you stuck around. We've got more to talk about and more to discuss. We do want to just give you a real quick update on what the rest of the show is going to look like. We have, as usual, some great guests. So, Dr. Nasser, do you want to let us just give us a brief preview on who they are and what we might talk about?
Absolutely, George. And remember, our guests, we talk about this all the time, and we say this saying, when you're right, you're right. When you're left, you're wrong. And our guests are always, always right. Our first guest is Dr. Jane Orient. She's a medical doctor, and she's going to be talking to us about the COVID-19, about a Danish Mask Study, and how that pertains to what's happening around the United States. We also have Robert Knight. He's a Washington Times contributor, and Robert's going to be talking to us about his article that he wrote in the Washington Times, The Democrats Call for Unity, but they vow vengeance. And then finally, we've got Dr. Carol Lieberman, who is America's psychiatrist, and she's going to be talking about the 5 reasons why we should not cancel Thanksgiving. So, George, once again, 3 great guests here on the Conservative Commandos radio show. And I just wanted to throw it back to you because I know in the last segment we were talking about some of the things that were happening under the Equal Protection Clause and how people are disenfranchised. So I know you had a couple of points you wanted to make, and we have so many other things to get to, but what were some of those points you were talking about in terms of disenfranchisement for some of these voters in the swing states?
Well, one of the principles that you mentioned, equal protection, is this, and this was upheld in Bush v. Gore in 2000. And the Supreme Court pointed out that you can't use different standards in one county versus another county in the same state. The state legislature creates a process, and they need to faithfully apply that procedure and not vary from it from county to county. And what we've seen in Pennsylvania would violate that principle pretty significantly. The state legislature had a very clear process laid out, deadlines and different standards. And one of them is, if you're going to mail your ballot in, if your ballot is incorrect, meaning that you didn't satisfy the legal requirements on the ballot, where you didn't sign it where you were supposed to sign it, or you didn't date it where you were supposed to date it, it's all clearly marked there. You just look for the blank spaces where they've asked you to fill something in. If you don't, then it doesn't count. But what we found is in the counties surrounding and the areas surrounding Philadelphia and Pittsburgh, when they got ballots that were incorrect, they would fill them out properly for them. They'd date them, they'd call up the voter to get the right address if they didn't put their address in, or whatever those things are, to fix the ballot. But everywhere else in the state, they were not given that opportunity. And of course, the statute didn't provide for that opportunity. So I think there's an equal protection clause here because you live in one county and you don't have to follow the rules, and your vote will count anyhow. And you live in another area and you can't. So it's just, that's an example of a problem, and I think it matters. And you look at, imagine, for example, if you went in to vote and they told you in one county, oh yeah, well, you can't vote today because you were supposed to wear a plaid jacket and you're not wearing a plaid jacket. You'd be like, what do you mean? No one else is having to wear a plaid jacket to vote. They can't give you new requirements or exclude things that elsewhere are permitted. And so it's just kind of an interesting problem. Now, I know that to date in the lower courts, those cases haven't always been successful. But just remember, neither was the Bush v. Gore case. Typically in the Bush v. Gore case, Bush lost early on But when it got to the Supreme Court, some of the decisions were actually 9-0 decisions because they were so obviously required under the Constitution. So the point is, we'll have to let this play out. We ought not worry about what a given judge, and either on the state level or the federal level, do, where it's going to have to work its way up to the Supreme Court. That's where this will ultimately be decided. And I don't mean the election, because the court will not decide the election. They will decide the process. And I believe they're going to decide that the process has been laid out by the state legislatures. And that's the process that has to be followed. In Georgia, that means that the consent decree is not legitimate for purposes of a federal election. Up in Pennsylvania, it's going to, there'll be other issues that will, and same thing in Michigan and so forth. So I think it would be a mistake to assume that we know the answers to all these things just yet. Just remember, it took like almost 40 days. So basically well over a month. And we're not there yet. So we don't know yet. And people want, that's why I think they're pushing so hard to get everyone to shut up and stop asking questions, because I think the left does not want to have some of these questions looked at carefully.
No, I certainly agree. So what else is out there on the horizon that you're looking at? Something that's maybe not pertaining directly to the presidential, political atmosphere or whatever, but are there any other interesting issues that we as Americans should be concerned about?
I know that you believe in life, liberty, and the pursuit of happiness, and so do I, and I think our viewers and listeners do as well. Apparently the legislature in Massachusetts does not as much. They just, I think they just made, the trend has been to make, in general, I think if you look around, the idea has been that we should protect life, and you see that happening in more and more states until very recently, and now you have some states with liberal legislatures and liberal governors insisting that we allow, like the governor of Virginia was advocating for the idea of abortions after a baby is born. He talked about aborting the baby after it's born. Now, medically, I don't understand how that's an abortion. That just sounds to me like you're killing a baby that was born. Because
that's infanticide.
Yeah, because the whole idea with at least the abortion was the justification. I'm not saying I agree with this. I'm just saying this is the justification was you shouldn't be able to force a woman to have a baby. Well, no one's forcing her to have a baby if it's already born. So now what's the reason? It's born. And so it's interesting. But then in Massachusetts, they kind of again expanded abortion rights in a interesting and odd sort of way. And again, I don't think it's supported by the public. Most of the public, if you ask them if you're pro-life or pro-choice, I don't know they know what those mean. But when you start asking people, do you favor abortion, moments before birth? The vast majority of Americans say no. Do you favor abortion after birth? Virtually everyone says no to that. If you ask them, do you favor abortion for sex selection purposes? People don't like that. That seems awfully, And so do you like abortion for the convenience of the mother? No, they don't. Now, if the mother's life is in danger, do you approve of it? Then you start getting some approval for an abortion. But so my point is, the left likes to play these games. But I don't think the populace and the numbers are on their side. I think most people actually are pro-life, even if they don't know they're pro-life.
And the thing is, in this type of thing, the left is so well organized because they have everybody behind them. They've got the Marxist mainstream media behind them. They've got the hypocrites in Hollywood behind them. They have the college and universities, academia, behind them. They've got their acolytes in the media, what we call the alphabet networks. I mean, they're all there, and at a moment's notice, they just get together and they descend on these places, and then all of a sudden, Twitter starts popping, and Instagram, and the Facebook chats, and all the other places, and pretty soon people start to look around and go, wow, maybe there are a bunch of people that are trying to do this. But I tell people this all the time, that we have to give voice to the voiceless. That's what you do. That's what our groups do. We have to defend the undefended. Nobody's defending. These are American citizens, and we are killing them. And I tell people we need to declare a new lexicon, and I refuse to say that abortions that the word abortion. We have to tie the word murder to abortion. I do it every single time I talk about it. I say these are murder abortions. I tell people we need to defund Planned Parenthood, and I say it's Planned Parenthood Murder Incorporated. I don't care if people think that I'm being politically incorrect, it doesn't matter, but I also think that what these people are doing is premeditated murder. That's what my personal opinion is, because you know what you're doing. You're going in there to kill this baby. Now they're talking about it's passed an amendment that would allow abortions after the 24th weeks, which I call fourth trimester pregnancy. You don't need parental consent. That means that's unbelievable. You need parental consent if you send your daughter to school, your son to school, and they need an aspirin. You have to write a parental consent and fill out stuff and then rip your finger with a pin so you can sign it off in blood, letting the nurse or the school official know when or where the child can take medicine. You know what we did? We just told our kids, guess what? If you have a headache, put some Tylenol in your pocket or your purse, and if you have a headache, take it. But we're not going to go and sign any damn papers giving consent. You can do it on your own. Now they're talking about there's a requirement to remove that abortionists have to preserve life. The whole thing about a doctor is first do no harm. This is just unbelievable. They passed this vote by 108 to 49. With the state Senate approved it by a vote of 33 to 7. It's going to be part of the fiscal year of 2021. And Governor Charlie Baker, he was critical of Democrats pushing this out there, but unfortunately they control the state legislature. They can make the laws, and like you said, most people are going to look at this and go, well, okay, what are we going to do about it? But that's why we need to fight this all the time. Because I'm just wondering, and I asked this question of Black Lives Matter. Do babies' lives matter? Do they?
It's a fair question. They should, but evidently not to some people. Not to some people, and it's sad. But we are up against the break, and we've got some great guests coming up, so I hope no one goes away, because as always, we will have fabulous guests. But I do want to remind our viewers and our listeners, this is the Conservative Commandos. He is the good doctor, Dr. Nasser Sheikh. I am George Landreth, and we will be right back with our first guests after these messages. Okay. All we got to do is
something a little different.
Yeah. We just got to do our wrap-up now, right?
Yep.
Okay. So I will bring us back, and you can tell us how to follow the different things and so forth, and then we'll say goodbye.
Okie dokie.
Here's a great way to save money on your prescription medications. If you take Viagra or Cialis, we can give you a way to pay as little as $2 a pill. Compare that to prices as high as $60 per tablet. Call now with your prescription and pay as little as $2 a pill. We offer 24/7 service and always free delivery and confidential packaging. Call Pharmacy Shop 24/7 to get generic versions of Viagra or Cialis for as little as $2 a pill, plus free discreet shipping.
Broken AC, $4,600. Water heater, $1,500. Fridge on the fritz, $1,000.
You need home warranty coverage from the Home Service Club
for around $1 a day. If any of your covered appliances and systems break down, HSC will either repair or replace them.
HSC provides coverage of up to 47 different appliances and systems in your home.
I trust HSC.
HSC has over 15,000 pre-screened, highly rated technicians with the fastest response time in the industry.
They cover everything from ACs, stoves, fridges, pool pumps, and more.
Call the number on your screen now for a free no-obligation quote from a trusted HSC specialist about a home warranty for your entire home, backed with a 30-day money-back guarantee. Call now and get 1 month free plus $75 off your first year of coverage. 1 month free and $75 off your first year. The Home Service Club.
I didn't know some Medicare Advantage plans may pay for dental visits. Did you?
I didn't know some Medicare Advantage plans may pay for transportation to my doctor. Did you?
I didn't know some Medicare Advantage plans may pay to have my prescriptions delivered directly to my home. Did you?
These and more are important benefits some Medicare Advantage plans may give you. So if you're eligible for Medicare, call us right now because you may be eligible to enroll in a plan with amazing additional benefits. Some Medicare Advantage plans may pay for services like these. these: dental visits, vision coverage, hearing coverage, home delivery of drugs, even gym memberships. Some plans may include no copays for many services and zero deductibles. Don't wait to find out if you're eligible to enroll in a plan that may include some of these wonderful benefits you deserve. Call us right now. The call is free, the information is free, and there's no obligation. Make this free call now to learn if you're eligible to enroll in a Medicare Advantage plan that may include additional benefits you want. Call us right now.
Here's a great way to save money on your prescription medications. If you take Viagra or Cialis, we can give you a way to pay as little as $2 a pill. Compare that to prices as high as $60 per tablet. Call now with your prescription and pay as little as $2 a pill. We offer 24/7 service and always free delivery and confidential packaging. Call Pharmacy Shop 24/7 to get generic versions of Viagra or Cialis for as little as $2 a pill, plus free discreet shipping.
Welcome back to the Conservative Commandos, the radio show, the television show. Thanks to the AUN TV network, the Conservative Commandos radio network, and of course, if you're not near one of the broadcast towers, never fear, because Al Gore's amazing internet is there to come to the rescue. We truly are everywhere, even with the Roku channel, for example. So we are there. We're just glad you're with us today. It's going to be a great show, and lots to talk about. But I have with me, of course, Dr. Nasser Sheikh. He's the co-host of the Conservative Commandos, and to be honest, he is the Republic's good doctor. So with that, Nasser, I'll leave to you the honor of introducing our guest.
Well, thank you very much, George. Definitely is an honor here. She's a patriot, and her name is Dr. Jane M. Orient. She's a medical doctor. She's currently the president of Doctors for Disaster Preparedness. She's also the author of Your Doctor Is Not In, which is a healthy skepticism about the national health care in the second. And she's got different editions of books that she wrote called Sapira's Art and Science of Bedside Diagnosis. She's authored books for school children. She's co-authored 2 novels, fashion English grammar books. I mean, she's done it all. She's also the editor and the managing editor of the Journal for American Physicians and Surgeons. And I know this was a long intro, but I'll tell you what, folks, if you want to know one of the top 10 docs in the United States of America, Dr. Jane Orient is definitely one of them. And we want to talk to her about her article that she published, COVID-19. It was about the Danish Mask Study. What is next? So we want to welcome you back, Dr. Orient, to the Conservative Commandos radio show.
Well, thank you. It's great to be with you.
Well, before we get into your article, let me ask you, because I've asked several colleagues of mine, whatever, what did you think of this whole vaccine situation where all of a sudden, right after the election on November 3rd, a few days later, we find out that Pfizer says, hey, our vaccine is 95.6% effective, and Moderna comes out a few days after that, it says ours is close to it, around 95%. So we're wondering, I had some of my friends say, well, they probably just figured that out and they just published it right away. I said, are you kidding me? They knew these results way before. They were holding back. They didn't let the president's team know that they were even this close to the effectiveness of the vaccine. They did this for political reasons only. Your thoughts? Am I just off the rocker here, or what do you think?
I think the timing is pretty interesting and rather suspicious. I mean, why just after the election instead of 2 weeks before? You have to wonder, but I also do wonder about the statistics. They say it's 90% effective. That doesn't mean if you get the vaccine, it's 90% effective at keeping you from getting it if somebody coughs in your face. What it means is that out of the 22,000 people who got the vaccine, very, very few of them, 5 of them, got infected, but only 89% or 89 people out of the 22,000 people who didn't get the vaccine got infected. So, I mean, your chances of getting the disease in that population were very, very low. So you have to wonder, how much risk is it worth taking for this warp speed vaccine if your chances of getting infected are very, very low to begin with?
Well, I completely agree with you. And, everybody sort of thinks now, it's amazing how people just go from one thing to the next. I have friends of mine, and I would say, these are not just, these are learned, supposedly learned individuals, I would think. And all of a sudden they're saying that, once a vaccine comes out, everything will be fine, we'll be cured of this. And I'm like, well, wait a minute. We have vaccines and we give out flu shots for the flu, influenza, all of these things. And yes, it does help the population. They have been around for a long time, but we've never eradicated influenza. We've never eradicated the flu. Different strains are always popping up. So my question is, even with the vaccine, when it comes out, we're still facing an uphill climb against this. Am I not right, or do you have other thoughts?
Oh, I think this virus is not going to just pack up and go away. Not even if everybody stays home. 60% of the stay-at-homes, or the people who got it in New York, were stay-at-homes. Not going to pack up and go away if everybody wears a mask or everybody gets a shot. That's just not how viruses work. But what is most appalling to me is that we do have very effective treatments for this. And for the first time in medical history, doctors are telling patients to go away, go home, shut yourself up, go to the hospital if you're about to die. And we're not going to even try to give you anything, even though there are a number of protocols out there that are showing great success in treating patients early in the stages of illness.
Well, you touched on, obviously, with the mask. So this, when your article that you published, give us a sense of what this Danish Mask Study, sort of shown to the public out there, and sort of, bring it down to its essence in terms of what this study was all about.
Well, this study was a randomized controlled trial, and we have to have randomized controlled trial according to the medical authorities before we dare to give you a drug that's been around for 65 years and is keeping people out of the hospital. But masks, we can force you to wear them without a randomized double-blind controlled study. Well, it can't be double-blind, of course, because you know where you're wearing a mask or not. But we did a study in Denmark, a randomized controlled trial, and we found out that it didn't make much difference, that the results were not statistically significant, that maybe masks decreased your risk of catching the disease by 46%, but on the other hand, maybe they increased your risk of getting the disease by 23%. It took a lot of difficulty to get this study published, but basically what it shows is masks might help a little bit, or they might actually make things a little bit worse. But even if they worked very well, we're still left with people who are getting sick. Most will get well, a few will die. We have treatment and we're refusing to give it to people.
Expand on it a little bit, Dr. Orient. What is this treatment that you're talking about that we have, and now you're basically saying that in some instances, or maybe many instances, doctors are turning away patients. What's going on with that?
Well, ever since February or March, we've known about hydroxychloroquine, which is a very widely used anti-malarial that was studied with SARS back in 2003 or something like that, and found to be effective in the laboratory. And people were taking it and they were getting well. The president mentioned it as maybe a game changer. And then all of a sudden there's been this worldwide war against hydroxychloroquine. It's not perfectly safe, but it's one of the safest drugs in history. They used to put it in salt in India to help prevent malaria. And doctors are getting very good success with this, and yet the FDA and other public health authorities are saying to people, oh, it's so dangerous. So people are afraid to take it, and doctors are afraid to prescribe it. And for one thing, they're afraid that their medical board might take away their license for this. But there are other drugs too, like there's ivermectin, which is a very commonly used antiparasitic drug. Some doctors are using with great success budesonide, which is an inhaled steroid. There are other protocols that doctors are using, and yet we have authorities saying, well, there's nothing that's been proved effective, therefore you can just go home and stay sick, or get sicker and sicker until you can't breathe.
Dr. Orient, give us a sense of what is happening in terms of the deaths that are being attributed to nursing homes. And is it true? I mean, I've even seen some of the statistics out there. I think I was on one of the government sites or whatever, that close to half of all the deaths that have occurred have actually occurred in the nursing home.
Exactly, and in the nursing home is less than 1% of the population, and yet nearly half of the deaths have occurred there. And these people are frail, they're elderly, they have a lot of comorbidities, they're at much higher risk from this disease, in contrast to the influenza, which cuts down young people as much as older people. But what the other thing that's happening to these nursing homes, that they are being neglected, they are being isolated, they are being deprived of everything that makes their life worthwhile, of the outside stimulus that even keeps them fed. One woman had even requested euthanasia because there was somebody got infected in the nursing home. They were threatening to put them in solitary confinement for another 2 weeks. She did very, very poorly after the first episode, said, I'd rather die than go through that again. And it's just, there's no evidence that it really keeps these people from getting COVID, or that they were getting COVID from their family visiting them before, but it does kill them for other reasons.
Give us a sense right now that you're seeing that around the world, we're hearing European countries are starting to go and start the lockdowns again. New York City with, Governor Cuomo, and all of a sudden, I think it was a Friday, Thursday or Friday, parents, they always found out, that schools were closed basically, and it was done. And now you're hearing, Gavin Newsom, the governor out there in California, is basically saying that, we're going to shut down, California again, perhaps until the end of the year. So with the minute left, just give us a sense in this segment here. Give us a sense of, do you expect the lockdowns now to continue and go into our secondary phase, so to speak, of this for no valid reason whatsoever other than the government and these bureaucrats want to do that?
Well, they haven't worked the first time. They're not going to work the second time. British newspaper, I think it was The Guardian, just came out with a very extensive article about the devastating costs of the lockdown and the fact that really COVID is killing very few people in England. It's not shutting down the National Health Service. The effect has been wildly exaggerated. The computer projections have been way, way off. Just about everybody who dies is being called a COVID death, even if it's death from something else. And so they're crippling the economy. They're destroying families and small businesses and churches for no reason whatsoever, except that the bureaucrats love to have power.
Well, we'll have to end this segment on that, but, Dr. Orient, we'd love to keep you for another segment. Do you have time to do so?
Yes.
Well, thank you so much, folks. You're watching and listening to the Conservative Commandos Radio Network and on the AUN TV broadcasting system in California. I'm one of the co-hosts. My name is Dr. Nasser, and on the other side, we've got our other co-host, George Landreth. We can be seen on all forms of media out there, iHeartRadio, also, like I said, in terms of, the Conservative Commandos Radio Network as well. So we've got to take a quick break. We've got to go to our sponsors, because as of now and today, I believe we are still a capitalist country here. So please listen to what our sponsors have to say, do business with them, and we'll be right back in just a couple of minutes with Dr. Jane Orient.
Are you paying too much for your health insurance? Are your deductibles too high? Or are you completely uninsured? If you answered yes to any of these questions, Healthcare Help Desk can help you now when people need help the most. Health insurance laws and rules have changed. If you have Obamacare, are uninsured, or your premiums are too high, call Healthcare Help Desk. It's free. New healthcare plans are available, and you may qualify for dental coverage and lower copays and deductibles. Make the free call now. Top quality coverage at the lowest prices anywhere. You may be paying too much and not even know it. In these troubled times, healthcare is more important than ever. Don't let another day go by without health insurance. Policies are being offered with very low copays and deductibles. So if you're uninsured, underinsured, or paying too much, call Healthcare Help Desk. Learn about your options before it's too late.
Call 800-964-1055. 800-964-1055.
Attention Medicare recipients and anyone turning 65. Medicare has approved new benefits not included with original Medicare and older Medicare Advantage plans. You may not be getting all of the benefits you're entitled to. These new Medicare Advantage plans may have many free new benefits, including in-home aids, telephone appointments with your doctors, home-delivered meals and prescriptions. These benefits may be available, and it's a free call to enroll. The easiest way to enroll is to call the Medicare Benefits Line, a free non-government service. The new plans may also offer free eyeglasses, free hearing aids, free wellness visits, and gym memberships. Call the Medicare Benefits Line now. It's easy. Find out if you're eligible for new benefits like meal and prescription delivery, in-home aids, and telemedicine. Some plans may have a $0 monthly premium or zero copays for big out-of-pocket savings.
Call 800-691-1655. 800-691-1655.
Medicare Benefits Line is not connected with or endorsed by any government agency or the federal Medicare program.
I owed the IRS $10,000.
The IRS garnished my wages.
They put a lien on my house.
I'm self-employed and didn't report all my income. They claim I owe a lot more than I do.
The IRS is the most powerful collection agency in the world. They do not give up until you pay.
I I couldn't sleep. We were being audited. I called Tax Solutions Now, and a great big weight was lifted off my shoulders.
I called Tax Solutions Now, and they got the IRS off my back.
Tax Solutions Now had my wage garnishment lifted in 48 hours.
Tax Solutions Now can get you help. Our agents know the rules, can stop the pain, and get you the best deal.
Tax Solutions Now saved my business.
I qualified for the Fresh Start program. I paid less than I owed.
We connect you with a team of former IRS agents and tax professionals who get the IRS off your back. Time is running out. Call Tax Solutions Now.
Call 800-447-7570. 800-447-7570.
Welcome back to the Conservative Commandos, the radio show, the television show, thanks to the AUN TV network, the Conservative Commandos radio network, Roku as well, and of course Al Gore's amazing internet. I'm George Landreth, and of course I am here with my co-host, the good doctor of our wonderful republic, Dr. Nasser Sheikh. We have been talking with another doctor. They're actually both MDs, so the reality is I'll try to ask questions that allow them to share information with you without stepping on things, because they're the smart people, but at any rate, we've got Dr. Jane M. Orient. She's an MD doctor, and we've been talking about just what's going on with COVID and what the science actually says. And so thank you for sticking to the break, Doctor. We appreciate that. But what I've noticed is this debate is constantly about just follow the science. You got to follow the science, and I've heard people tell me all the time, Joe Biden, he's going to follow the science. He's going to follow the science. That's what we need. A president will follow the science. And I'm kind of scratching my head and saying to myself, okay, so this president restricted travel from areas that were hotbeds of infection. There's probably some scientific basis for not bringing sick people into your country. Might help you keep it down, and other things like that. But then they're trying to tell us that it's scientific that, you can't get COVID at Costco if you're wearing a mask, but at church you're probably going to die, or this kind of stuff. And I scratch my head because that's where the rules work out. The rules work out that at my house for Thanksgiving, I am totally at risk. But at Costco, I'm good. No problem. And I just kind of ask myself, what's the science behind all this? Because I don't see a lot of science. I remember when, I think it was Governor Whitmer of Michigan, I made it so you weren't even allowed, for example, to go out on the Great Lakes, which are huge. So you could have your own boat by yourself, and that wasn't socially distanced enough. And I just I scratch my head and say, these people say science, but I don't think they believe in it.
Well, obviously they don't. They don't believe in reason, logic, common sense, or science. They have a total double standard about you can't use hydroxychloroquine because we don't have randomized controlled studies, but we can put people in the equivalent of solitary confinement, not look at the adverse effects, not look at whether it does anything to reduce infection, and pretty good evidence that it does nothing. And then we'll say that we're following the science. The randomized controlled trial is something that came about quite recently, that doctors have always been following the science in terms of observational studies, of statistical adjustments in these studies to correct for biases. If you look at C19study.com, there are about 145 studies of hydroxychloroquine. The majority of them are peer-reviewed, and the chance that you could have the results that they have with a treatment that is ineffective are about 1 in 235 billion. Not 5 in 100, which would be statistically significant, but less than 1 in 235 billion. And they're saying, well, that's not scientific. I mean, it just makes me just very, very distressed to find that people are denying patients treatment and claiming it's on the basis of science. They're letting them suffer and die, go to the hospital and die all by themselves when they could have been saved by being treated early at home with something that thousands of physicians throughout the world are using with success. And by the way, third world countries like India have a mortality rate 1/10 of ours because they are using early home treatment with these long-used, very safe medications.
You make a very good point. The studies, what they, if I understood you correctly, and the things I've read are, we don't have lots of these randomized double-blind studies about how to use this particular drug with respect to people who have COVID. But this has been around for like my entire lifetime. It's been used, I mean, there in many countries, it's available over the counter the same way aspirin or Advil is. So as long as you follow the instructions in the box, I mean, I realize if you were to take an entire bottle of Advil, that would be bad for you. But we assume people can read the instructions and take 2, or whatever. And my understanding is that's the level of safety with this particular drug, which is if you don't take the whole bottle, you're going to be okay. And in some countries, they take it as a prophylactic because of the problems they have with malaria. So you have generations now who've taken it basically every day of their life. And, we'd know by now if they were, dying from this medicine. And so to me, it's frustrating to hear them talk about science that way.
Absolutely. And in fact, hydroxychloroquine is safer than Benadryl or Tylenol or Advil or a whole lot of other drugs that you can get over the counter. Of course, you can overdose on that just like you can overdose on salt or water. Right. The one negative witness at the Senate hearing about hydroxychloroquine and other early at-home treatments was, the calls to the Poison Control Center increased by 95%. Well, a lot of people were concerned because they had taken one pill too many, and they were just worried about it, so they called the Poison Control Center. After all, they've been barraged with propaganda. I would call it disinformation about how deadly this stuff is, and so they're afraid to take it. Doctors are afraid to prescribe it because what if the patient had some heart condition, which a huge number of people in the United States have anyway, and they'll be blamed for prescribing this drug, which actually helps your heart probably in almost every instance.
Let's talk about what the science behind dramatic economic shutdowns are, because my understanding, and I'm not a scientist again, but this is my personal observation, which is poverty does not lead to good health outcomes, all else being equal. In other words, societies where there's wealth, people, and I don't mean Bill Gates' wealth, I just mean you have hospitals close by, you've got research facilities that are operating at full bore, those kinds of things. That and there's a society that's that kind of affluence, that you generally get better healthcare outcomes in that society than you would in a society that's third world where there aren't hospitals, or if they are, I've been in a hospital one time and I thought to myself, I would never have surgery here. There were cats roaming the halls, and it was like, it looked more like it was a shelter than it was, an animal shelter than a hospital for humans. And yet we have these policies that are driving our economy into the ground. And it doesn't seem like that's going to be good for health. So what's the science behind that? Because again, I'm not the scientist you are.
Well, the science is just pretty obvious common sense. And the social determinants of health, that's a really big deal in medical publications. And not just about having research facilities, it's about having food and electricity and heat. In the wintertime, the United Nations predicted that 230 million people are going to starve to death because of the economic consequences of these shutdowns. I mean, some people can work at home and they still keep drawing their paycheck, but the fact is, if farmers aren't planting crops and harvesting them and taking them to market, and the meat packing plants aren't working, there's not going to be food. People are going to starve to death.
Yeah, well, and that's not good for health. Yeah, I'm not even a scientist, and I think I totally understand what you're saying. But it is interesting because it seems to me, and this is where I'll ask you to kind of correct me if I'm wrong, but it seems to me you could do things to protect the most vulnerable people in your society, which isn't even people over 70. It's kind of people of poor health over 70. In other words, like if you're in a nursing home, it's not just that you're over 70. My mother's over 70. She mows her own lawn and does her own, she's in great health. I don't think she's the same at risk as maybe the person who's in a facility because of poor health. But the bottom line is we can protect those individuals without shutting everything down. And yet we seem to have. Am I wrong about that? And from a scientific perspective, is there a way to be careful and be mindful of those who are at risk, and then for the rest of us kind of say, let's keep things rolling because poverty is bad, because suicide is bad, financial ruin is bad, et cetera, et cetera?
Well, it's like with AIDS. There's the universal precautions. You assume that everybody might be contagious, and certainly in influenza season, a lot of people are contagious. It makes good sense to stay away from people if you're sick. We need to make sure that people who are infected aren't working in the nursing home and transferring infections from one place to another. I don't think it's the visitors or allowing patients to go outside that's the problem. It's very likely the staff. And yeah, protecting the vulnerable does not mean confining to home everybody over a certain age, or everybody who's obese, or everybody who has some sort of comorbidity. It's about using good common hygiene, which will protect us from a lot of other things too. We ought to be washing our hands more as a general routine. We ought to be mindful about staying home when we're sick. At other times, not just now.
Good point. Very good point. Well, our time's about up, but I wanted to ask you if you could tell our viewers and our listeners how they can follow the work that you do, because they're not going to get a steady diet of the common sense and the science-based information you're getting. If they're listening to other, besides the conservative commandos, they're going to get a lot of this kind of fear-mongering going on. So how can they get a steady diet of you, Doctor?
Our website is aapsonline.org. That's for the Association of American Physicians and Surgeons, aapsonline.org. The very first thing that you see when you went on there is for downloading our patient booklet on early COVID treatment. We also invite you to submit your stories if you have a experience with yourself or a loved one being ill with COVID. Tell us your story. We've just been hearing stories from all over the country about people being denied treatment, or people who are doing very well if they get treatment. And so to tell us your story, you can go to our website, apsonline.org/COVID-19- that's a -treatment -tell- your -story. So if you go to our website, you will find that, and we would like to hear from you.
Excellent. Thank you. Just a great source of information. We appreciate you sharing that with us. Dr. Jane Orient, we really appreciate it. And we are up against the clock, so we're going to take a break here. But I do want to remind our viewers and our listeners, this is the Conservative Commandos. If you want to rebroadcast, if you missed anything or want more information, check out our website, ccrshow.com.
Everybody wants cheap airfare, but where do you find it? You call low-cost airlines. Their prices are direct from the airlines, and they're so low you can't find these fares published anywhere. They specialize in cheap flights, discount hotel rooms, cheap car rental rates, and great package deals anywhere around the world. Wherever you want to go, they can help you get there cheaply and with a best price guarantee. If you want the lowest prices on your airline tickets or other travel services, call now. That's right, call. That's the only way to get these rates. Experts are standing by 24/7 to get you the cheapest airfare and hotel rates available. So don't wait. Call right now for the lowest travel prices anywhere and for great last-minute travel deals too.
Call 888-431-0562. That's 888-431-0562. 888-431-0562. 888-431-0562.
Dish TV is better than cable TV. Here's why. Dish has the nation's lowest TV price, along with an award-winning DVR that can skip commercials, record 8 shows at once, and get access to thousands of movies at your fingertips. Cable simply can't even compare. So the smart choice is to cut the cable and get Dish. Plus, you get all these great TV features, free HD DVR upgrade, free installation, and free movie channels. Say goodbye to cable and get more with Dish TV. 877-290-7764, 877-290-7764. As an added bonus, you can switch to Dish now and receive a $50 Visa gift card. So call now and get Dish TV. Call 877-290-7764, 877-290-7764. That's 877-290-7764. Limited time offer, 24-month commitment and credit qualification required. Cancellation fee, monthly equipment fees, and other restrictions apply. Promotion can change at any time.
Friend, do you remember when it felt good to withdraw your cash from the bank to expand a business, go on vacation, or buy a new car? Well, today, withdrawing your own cash has become a very risky business, according to The Secret War, a shocking new research report. I just read it. And folks, I was amazed to learn why banks are now required to spy on us for the government and then report any suspicious or unusual behavior. I suggest you get The Secret War free. Just call the number on the screen, no charge, from the folks at Swiss America, and get this. Did you know simply spending cash today may be enough to have you branded as a potential criminal? That's right. The new war on cash is really a war against all freedom-loving Americans. The secret war is yours, free, so call the number on the screen and you can tell them Pat Boone gave you the number.
Welcome back to the Conservative Commandos, the radio show, the television show, thanks to both the AUN TV network and, of course, the Conservative Commandos radio network. And if you're not near one of those broadcast towers, never fear, because Al Gore's amazing internet brings us everywhere. Maybe not China, North Korea, and Iran, but everywhere else where the internet is allowed to talk about freedom, we're there. I'm George Landreth, and of course I am here today with my co-host, the good doctor of our republic, Dr. Nasser Sheikh. And just want to remind you, if you all want a rebroadcast of our show, check out our website, ccrshow.com. And with that, Nasser, the honor to you is of introducing our guest.
Well, thank you, George. Well, we have Robert Knight. He's a Washington Times contributor. His experience also includes he was the editor and writer at the Los Angeles Times. And to let everyone know that not only is Robert a great patriot, but he also is one of the few fellow journalists that are out there that still practice the essence of real journalism. He's got a regular weekly columnist for the Washington Times and townhall.com and onenewsnow.com. He was a media fellow also at the Hoover Institute. He's held senior positions with the Heritage Foundation, the Family Research Council, Concerned Women for America, and the Media Research Center. His latest book is A Strong Constitution: What Would America Look Like If We Followed the Law in a Nation Worth Fighting For? 10 Steps to Restore Freedom. I forgot to ask, but during the break, sir, if you have those books around, we'd love to have you show one up for our audience so they can take a look at it.
Oh, okay. Yeah.
Right.
Well, I also have another book, a couple books that just came out this year.
Sure. What are they? Go ahead.
Yeah, and people can get them at roberthknight.com. I've got all my books listed up there. Let me just grab a couple things. The Coming Communist Wave. What would happen if the left captures all three branches of government, which suddenly is not just theoretical. It's a real wake-up call for that. And also Liberty on the Brink. That just came out this year, and it's all about the ways that they're trying to steal the election. So both of them are quite relevant right now. And both are available on my website, roberthknight.com.
Well, not only a journalist, but a prophet as well. Okay.
Maybe. I don't want to be a prophet that way. I want to be wrong.
Right. Well, the article that you wrote, sir, in the Washington Times, Democrats call for unity, but they vow vengeance. So give us a sense of what your whole feeling is about this, trying to be this kumbaya movement for the Democratic Party with the, go ahead, let us know what your thoughts are.
Well, yeah, the media are chastising conservatives for not getting behind the idea that Joe Biden won the election, and we shouldn't even look at the vote. We shouldn't, if they had their way, they'd stop the count as soon as Biden went over the top and not examine, do any recounts, look at possible voting irregularities in many states. They don't want to examine the affidavits filed, hundreds of them, according to Rudolph Giuliani, the president's lawyer. What I find most interesting are the anomalies of this election. Okay, this isn't hard evidence, but think about it for a minute. The Republicans retained all state legislatures that they held. They added both houses of New Hampshire. They added at least one governorship. 18 of 19 bellwether counties went for President Trump. These are counties that have always voted for the winner in the presidential election since 1980. 18 of 19 went for Trump, and I think the average winning margin was something like 16 points. That just doesn't happen if Joe Biden won the election. 25 Republican-held seats in Congress were considered toss-ups by the Cook Political Report before the election. All 25 were victories for the Republicans. If you look across the board at the heavy Republican vote, including 10 million more votes for President Trump than he had in 2016, it's hard to swallow the idea that he lost to Joe Biden, a guy as corrupt as the day is long, hiding in his basement, apparently deteriorating, sadly, mentally, and with a Marxist running mate, Kamala Harris, who has deep Marxist roots in the Bay Area. America's ready for that after all the rioting in the streets in Democrat cities and all their threats about what they're going to do if they get total control, shoved through their left-wing agenda. And America bought that and elected Joe Biden and Kamala Harris? I don't think so.
You're absolutely right. I mean, I've got something here that I was going to be talking about a little bit later, but, they talked about, for example, that he underperformed Hillary Clinton in every major urban city in the United States of America in 2020, except for 4. Except for Atlanta, Milwaukee, Detroit, and Philadelphia. And not only did he overperform there, they're talking about super performing. In other words, he did better in those areas than in 2008 Obama, in some areas in 2016 with the, during what, Hillary did. And then the other thing they're talking about here is that Biden won a record low 16.7% of United States counties, but somehow they said he got the most votes in history. He only won, they said, 524 counties, the lowest total ever for a winning candidate. So does that mean that in those other 4 metropolitan areas, he just super performed at that 90-95% level? I mean, you're absolutely right. Some of these anomalies, that they just don't make any sense whatsoever.
No, they don't. And I hope the hard evidence is there for the Trump attorneys to present to the appeals courts. In fact, this week, they say they're going to present the hard stuff, and they've been withholding it. And, of course, the media has accused them of not having a winning hand because they didn't give it to the media so they could tear it apart and misrepresent it. They're saving the evidence for the courts. And I just, I hope the release of the Kraken is a legitimate threat to expose massive vote fraud. I, like millions of Americans, believe there was massive vote fraud. It just, this idea that Biden won just doesn't wash. And we're not going to be intimidated by the media calling us racists and un-American and not unifying and all kinds of terrible names just because they want Biden to quickly be ushered into office so he can enact their agenda. In my column this week, I talk about the Washington Post accusing the GOP of having a dishonest slander on the election. And I thought, well, that's funny. I thought maybe they'd go for an honest slander as opposed to a dishonest slander, but the Post was so frothing at the mouth it had to combine the two descriptors because they hate Trump so much, they hate conservatives so much. I combined analysis of their editorial with a column by Dana Milbank, who's a longtime columnist for the Washington Times. Washington Post. Never the twain shall meet. Washington Times is a real newspaper. Washington Post is now an arm of the Democratic Party, and even the far left wing of the Democratic Party. And Dana Milbank is one of their main columnists, and he wrote a column trashing white Christian conservatives because they turned out in greater numbers than any other demographic group. He said that white Christian conservatives account for 15% of the population, but 26% of the turnout. So he's saying the only thing that can explain this is that they were going for white supremacy, because Trump is all about white supremacy. No evidence of that, whatever. Just, he says it. He just smears millions of people. And this has just become common parlance in the Washington Post. They just smear Christians every day. They smear conservatives every day. They smear Republicans every day. It's not even a legitimate newspaper anymore. And neither is the New York Times, for that matter. It's the same stuff.
You're absolutely correct. I mean,
and you guys are the antidote.
Well, so are you.
Well, thank you. And the Washington Times tries to get the word out, and that's a real newspaper. It's not fake news. At the Epoch Times, I think it does a tremendous job now. I'm a subscriber now. I didn't used to be, and I realized that I needed to get their stuff. But, this Samizdat has grown up. That's the name that for the underground press in the old Soviet Union. That was where people got the real news. The official news from Pravda and Izvestia was just a pack of lies. Every once in a while you'd find truth in maybe the final paragraph. And of course, that's what I do when I read the Washington Post every morning, which I have to because of what I do. I go right to the end of the article and see if the real news is buried there. Anything that doesn't conform to the left-wing narrative is buried in the last paragraph.
No, you are so right. And you know what? I mean, there's a new essence coming on. I think the times of these giant, huge conglomerates, I think is ending. I think we're going to be going to this new network-based type of thing, such as One American News Network, Newsmax, for example. I mean, they just said that they lost, I think, over 300,000 subscribers to the Fox News app, and the ratings all across the board, I mean, are completely, tanking. And I've been telling my friends and colleagues for a long time, they said, oh, Nasser, you're always watching Fox News. I said, I have to watch it because of what we do. But for the last 5 or 6 years, since, Ailes passed away, and what's his, I don't even know if I want to even release his name, but he and his, two sons have now taken over Fox. They have lurched left,
Well, there's
very
no
much
doubt
so.
about it. Look at Chris Wallace's conduct during the first presidential debate. He just kept interrupting Trump, debating with him. He didn't do that to the other guy. He didn't want to embarrass Biden, I guess, and put him under too much pressure. But yes, the network has lurched left, except for some people on the evening, like Tucker Carlson has done a sterling job, I think, and Hannity and Laura Ingraham. They're still solid. I know Tucker got in a tussle with Sidney Powell, accusing her of withholding stuff, and she should have appeared on his show, but she didn't give enough evidence, so he was upset with her. That's a little tiff within conservative ranks. Doesn't mar his overall excellence. Where he'll tell you stuff the mainstream media are trying to cover up every day. It's really shocking how much of a cover-up is going on. Twitter suspending the New York Post account when they had the audacity to reveal the Biden corruption in China. They had chapter and verse. This wasn't just guessing. This wasn't rumor. They had it. They had them cold. And because of Hunter's laptop, and then the gentleman who came forward, who was Biden's business partner, Hunter Biden's business partner, nobody's been able to touch him for his credibility. What they do is they just stamp it out. Don't let the public hear it. They stamped this out 2 weeks before the election. That's why big tech fixed the election by withholding crucial information. I think it's criminal in nature, what they did to push the election in Joe Biden's direction. I don't know if there are any charges that could be brought. I mean, media is media. If they're going to be dishonest, the best cure is more media, like conservative Commandos. But meanwhile, they did a tremendous damage. And do you remember we were warned about this by that expert on social media? Because
Robert, you're going to have to hold that here because we're going to have to take a hard break here in terms of that. And you're just part and parcel of what we do. But we're speaking to Robert Knight. He's a Washington Times contributor. And you're listening to us on the Conservative Commandos radio network and also watching us on the AUN TV network broadcasting system in California. We're still a capitalist country, at least for the time being, folks. We've got to do some business with our sponsors. So we'll be right back with Robert Knight on the other side and my co-host, George Lambert. So don't go away, stick around. We'll be right back in just a couple of minutes.
Here's a great way to save money on your prescription medications. If you take Viagra or Cialis, we can give you a way to pay as little as $2 a pill. Compare that to prices as high as $60 per tablet. Call now with your prescription and pay as little as $2 a pill. We offer 24/7 service and always free delivery and confidential packaging. Call Pharmacy Shop 24/7 to get generic versions of Viagra or Cialis for as little as $2 a pill, plus free discreet shipping.
Broken AC, $4,600. Water heater, $1,500. Fridge on the fritz, $1,000. You need home warranty coverage from the Home Service Club for around $1 a day. If any of your covered appliances and systems break down, HSC will either repair or replace them.
HSC provides coverage of up to 47 different appliances and systems in your home.
I trust HSC.
HSC has over 15,000 pre-screened, highly rated technicians with the fastest response time in the industry. They cover everything from ACs, stoves, fridges, pool pumps, and more. Call the number on your screen now for a free no-obligation quote from a trusted HSC specialist about a home warranty for your entire home, backed with a 30-day money-back guarantee. Call now and get 1 month free plus $75 off your first year of coverage. 1 month free and $75 off your first year. The Home Service Club.
I didn't know some Medicare Advantage plans may pay for dental visits. Did you?
I didn't know some Medicare Advantage plans may pay for transportation to my doctor. Did you?
I didn't know some Medicare Advantage plans may pay to have my prescriptions delivered directly to my home. Did you?
These and more are important benefits some Medicare Advantage plans may give you. So if you're eligible for Medicare, call us right now because you may be eligible to enroll in a plan with amazing additional benefits. Some Medicare Advantage plans may pay for services like these: dental visits, vision coverage, hearing coverage, home delivery of drugs, even gym memberships. Some plans may include no copays for many services and 0 deductibles. Don't wait to find out if you're eligible to enroll in a plan that may include some of these wonderful benefits you deserve. Call us right now. The call is free, the information is free, and there's no obligation. Make this free call now to learn if you're eligible to enroll in a Medicare Advantage plan that may include additional benefits you want. Call us right now.
Here's a great way to save money on your prescription medications. If you take Viagra or Cialis, we can give you a way to pay as little as $2 a pill. Compare that to prices as high as $60 per tablet. Call now with your prescription and pay as little as $2 a pill. We offer 24/7 service and always free delivery and confidential packaging. Call Pharmacy Shop 24/7 to get generic versions of Viagra or Cialis for as little as $2 a pill, plus free discreet shipping.
Welcome back to the Conservative Commandos, the radio show and the television show. The AUN TV network, the Conservative Commandos radio network, Roku, the internet, Al Gore's amazing internet, as I like to say, with our own website, ccrshow.com. You can get rebroadcast. All information is there. Don't forget that. If you missed any portion of our show or want to catch something that maybe you were traveling and missed a show, you can still catch us. I'm George Landreth with Dr. Nasher Sheikh. We're your co-host today. We're glad you're here, and we're glad you stuck around because we've been talking with Robert Knight. He's a columnist with the Washington Times. He's also the author of some very interesting books, ones that you ought to consider, and you can get them at his website. And website, if I recall, was that robertknight.com. roberthknight.com. But anyhow, those books include Liberty on the Brink, another one, The Coming Communist Wave, another one, A Strong Constitution, What Would America Look Like If We Followed the Law? Now that's an interesting question. I think that most of our problems are because we stepped away from that stuff, but at any rate, and then of course, A Nation Worth Fighting For, 10 Steps to Restore Freedom. So those are some, I think, those sound like some great topics to get books on. So thanks, Robert, for sticking through the break. We, not just was it last week, had big tech in for some hearings. We saw how they shut down and tried to remove from the public eye the story of the Biden crime family's corruption. It was interesting. I saw some polling data that suggested that 1 in 3 voters that voted for Joe Biden had no idea of these allegations. They'd never heard them before. So they certainly seem to have been somewhat effective. What was also interesting was of these people who voted for Joe Biden that didn't hear about it, most of them said that had they heard about it, it would have changed their vote. So, I don't know. It sounds to me like we had election interference, but it wasn't from the Russians. It was from, Americans using technology to mislead and deceive voters.
Yeah, and there was more than that. Robert Epstein is a Harvard-trained psychologist and researcher, and he warned that Hillary Clinton got 2.6 million more votes because of manipulation by the big tech giants like Google and their search engine, Twitter, Facebook, and how they manipulated results to turn out the vote for Hillary Clinton. And he warned that this time around, they were in a position to affect as many as 15 million votes.
Wow.
Because when you do a search on Google, the first 5 items come up, and most people don't go beyond that. And they can engineer it so their search engine yields what they want you to see, and they can bury deep any contrary opinion, and that's what they've been doing for years, apparently. They've been caught at it. They go before Congress. Jack Dorsey, head of Twitter, just assured Congress that Twitter never discriminates, which is nonsense. He admitted they shouldn't have taken down the New York Post. It wasn't enough to take down the articles that spelled out the Biden crime family connections in China and Ukraine. They shut down the whole New York Post site. I mean, New York Post is America's oldest major daily newspaper, I guess. And they said, no, Americans can't.
I think
read
Alexander
this.
Hamilton started it.
Yeah, right. But it's not good enough for Twitter. So Dorsey, under intense questioning, admitted, and that probably wasn't a good idea, but, water under the bridge after November 3rd, and continuing counting and so forth. Now, it's very scary how much power these big tech organizations have. And I would include Amazon in that, because they have been using material from the Southern Poverty Law Center, which is a anti-Christian, anti-conservative hate group headquartered in Montgomery, Alabama. And they have designated many mainstream Christian groups as hate groups. And so Amazon has the Amazon Smile program, where you can designate some of your purchase price to a charity. And if you're not in the Smile system, you're not going to get any money. So Amazon has kicked out all the Christian charities that the Southern Poverty Law Center has designated as hate groups. I mean, we're talking Family Research Council, where I used to work. I worked there for 10 years. It's not a hate group. It's a mainstream Christian pro-family group that does research on family-related issues. The Liberty Counsel is considered a hate group. That's one of the best law firms in the country, and it takes on all sorts of cases of mostly involving religious liberty. On and on and on. That's just Amazon, which has enormous purchasing.
Well, one thing that I thought was interesting, it is Joe Biden who referred to religious liberty as being dangerous because, quote, it was a safe harbor for hate. So being religious is a safe harbor for being hate if you give the First Amendment protections of liberty. So it sounds like he's articulating a reason why we don't need religious liberty anymore. And so that he's very much aligned with these guys, whether it's Amazon or these others.
I'd like to see the full context of that. It sounds very alarming if we can take that at face value. But clearly his idea of religious liberty is not shared by people like us who actually believe in the First Amendment, think that all views ought to be able to be expressed outside obscenity. That's not protected speech. Yelling fire in a crowded theater falsely is not protected speech. But beyond those few examples, or communicating national security secrets, which could put the nation at risk, okay, there's a limitation. But as far as political opinions, assertions about the validity of the election and so forth, they have no business censoring those.
Right.
That's where they've come now. They say, we can't allow this kind of opinion to go unrestricted. And so Facebook has been sticking in little messages. If you put on Facebook an article that you find compelling that questions the veracity of the election, they'll put a little box saying, well, this is questionable analysis at best and may be inaccurate. In other words, they don't trust the readers of Facebook to discern between good information and misinformation. You know, that's really rich coming from these sources of fake news for years. They had no such compunctions when the Russian collusion hoax was being pushed hard. They didn't question those. They didn't put little explanatory notes accompanying those posts.
They didn't even need any evidence. A sheer allegation, which have now turned out to all be false lies, and in some cases perjury. You know, government officials perjuring themselves on FISA warrants and things like that. But that's no problem. It's okay.
Yeah, it was okay with them. It was okay with Twitter, Facebook. They didn't see any problem. Google, no problem. If it's in the left-wing direction, it's no problem. Here's the problem. The people at the top of these tech giants and those working for them, they're in the Bay Area, very liberal area. In fact, it's you might even say the Bay Area is a fountainhead of Marxist views. Kamala Harris's father, I guess, was a socialist professor, and she has many Marxist connections. That you ought to get Trevor Loudon on here. He's got chapter and verse. He's an investigative reporter who has looked at Congress. He's looked at the Democratic Party and found Marxist and outright communist connections. But the worldview of these guys is so far left now that they have taken on a totalitarian mindset. You agree with them or they're going to mess with your freedom of speech. They've got the power to do it. And that Section 230 of the Telecommunications Act, that's got to be revisited. They have become, they enjoy the protection of the publishing industry, but and as a conduit, and a clearinghouse for information, but they don't allow it. They only allow the information they want to let you hear. So why should they have a privileged position in the communication stratosphere? You know, you don't see the telephone companies determining what to say on the phone, do you?
Yeah. Can you imagine? You call up
we disapprove of this conversation.
Yeah. Click.
They don't dare. The telecommunications enforcers would crack down on them. And yet you have Facebook and Twitter and Google doing it, which have at least as big a reach as the telephone companies.
Yeah.
That's got to change.
Oh, absolutely, it does. Well, Robert, we're about out of time, but what I want to make sure our viewers and our listeners get is a reminder of where they can find information that you provide, both your books, your columns, and so forth. I believe it's going to be roberthknight.com, but tell us, Twitter, the whole 9 yards. How are to follow you?
Okay, well, roberthknight.com is the best way. Just put that in as a URL. I also, the Washington Times has all my columns. Just go to the columnists and I'm listed. I also write for One News Now. Town Hall now occasionally. I have a new relationship with them. I was in every week. Now they've now decided that I can't be in if the article runs in the Washington Times first. And you're the first to hear this. So if you don't see me on Town Hall anymore, that's why. I've been writing for them for 10 years. First writing for the Washington Times, and then letting a time period go, and then sending it to Town Hall. They've had no problem with that for 10 years. All of a sudden they do. Okay, fine. I'm now on Gab, Parler. These are the rising new media that we have to support. Gab was founded by a Christian. He's very serious about his faith. Parler is founded by Dan Bongino and others. I think Dan's a Christian too. I'm not sure, but he sure is a conservative. They're growing by leaps and bounds because nobody trusts the media anymore, nor should they, or big tech. Right. So the good news is we have a rising force of alternative media in this country, from Christian talk radio to shows like Conservative Commandos. This is the samizdat that I described earlier, the underground media that's becoming above ground very quickly.
Yep. Well, we certainly appreciate you spending time with us, Robert. It's been great to have you on the program, but I want to remind our listeners and our viewers, this is the Conservative Commandos. I'm George Landreth with my co-host, Nasser Sheikh, and we will be right back after these messages. Don't forget our website if you want to rebroadcast, ccrshow.com.
Attention homeowners, do you have a house that's in need of serious repairs? Do you have tenants that never seem to make their monthly payments? How about code violations, past due taxes, or maintenance costs you just can't afford? Then call my friends right now at Quick Cash Offer. They specialize in buying any home, no matter how ugly the situation. Turn that problem property into cash right now. It's just that simple. One call and you can get rid of that home headache forever. They buy the ugliest houses with instant closings, instant cash, and huge savings. Plus, there are no realtor fees, no listing fees, and no repair costs. Just cash in your hands for that painful property. They're buying a few more houses in your neighborhood this month. So take advantage of this cash offer and call Quick Cash Offer now.
855-296-8854. 855-296-8854. That's 855-296-8854.
Listen carefully. If your student loan debt is overwhelming you and things seem hopeless, we've got great news.
If you're still struggling with your student loan debt, there are government programs available that may actually lower your payments by consolidating your federal student loans. Just call us. We'll review your situation and work with you to consolidate your debt. In many cases, depending on your situation, we can lower your monthly payments in half or more. It doesn't matter how much you owe or how far behind you are. Even if you're in default, call us right now to find out how we can lower your payment in half immediately. You can stop the harassing phone calls and the wage garnishments. All you need to do is pick up the phone and call us right now. We can remove your default status, consolidate your federal student loans, lower your payments, and we can do it today. Stop worrying. This is a real solution that can help. So please call us right now.
Call 800-917-8671.
Are you over the age of 50? Want peace of mind and financial security for your family? Here's an important message to you and all seniors from the Final Expense Insurance Hotline. The average funeral costs about $7,000, even more. And the most government benefits will pay your family is only $255. That leaves your loved ones with a burden of paying your debts and funeral costs. Our plans start as low as $1 per day and will pay up to $30,000 for your funeral and other final expenses. There's no medical exam and you'll have lifetime coverage. Plus, your rates will never increase and your plan cannot be canceled regardless of your medical condition, as long as you make your premium payments. Get free information right now. Just answer a few simple questions and get approved right over the phone in just a few minutes. Call right now.
Call 855-221-7334.
Do you have an idea for an invention, but you don't know what to do next?
How do you get in front of companies or get a patent?
Call InventHelp. They've been helping inventors just like you for 35 years.
And thousands of people contact them every month.
With 65 offices, you can meet with an InventHelp representative near you who will keep your idea confidential and explain their invention process step by step. InventHelp has helped over 10,000 inventors get patents. And they offer 3D animations and prototyping services to help demonstrate your idea. InventHelp's exclusive databank includes over 9,000 companies who have agreed to confidentially review new ideas, like yours.
Don't wonder what to do next. Take action right now and get the help you need from InventHelp.
InventHelp. Call today for free information.
800-880-2937. That's 800-880-2937 now.
Welcome back to the Conservative Commandos, the radio show, the television show, carried on the AUN TV network, the Conservative Commandos radio network. And if you're not near one of those broadcast towers, never fear, because Al Gore has solved the problem with his amazing internet. We truly are everywhere. You can get us on Roku. You can get us at our own website, ccrshow.com. You can get us on YouTube, you name it. We truly are everywhere. iHeartRadio, we're everywhere. So just want you to remember that, because there's never an excuse for missing an episode of the Conservative Commandos. I'm George Landreth, and the good doctor, the doctor of our republic, Nasser Sheikh, is my co-host today. We're glad you're with us. And Dr. Sheikh, I think it's your opportunity to introduce our next distinguished guest.
Well, thank you, George. We have America's psychiatrist here with us. Her name is Dr. Carol Lieberman. She's an MD. She's a board-certified Beverly Hills psychiatrist, which probably means she has an unending supply of patients in that area. She's also an award-winning and best-selling author. She served on the clinical faculty of UCLA's Neuropsychiatric Institute for years. When she isn't seeing patients, she's a forensic psychiatrist, and she has Emmy-honored TV personality who's appeared on many of today's shows. If you know, Today Show, Good Morning America, CNN, Fox, you name it, on the Alphabet Network, she has been there. She also hosts 2 radio shows and podcasts, and she has a latest book out, which is for children and their parents and teachers. It's titled Lions and Tigers and Terrorists, Oh My, How to Protect Your Child in a Time of Terror. So, Dr. Lieberman, we welcome you to the Conservative Commandos radio network here, and we want to talk to you about that article you wrote, 5 Reasons We Should Not Cancel Thanksgiving. So, once again, welcome to the Conservative Commandos radio show.
Thank you so much.
Well, before we get into your article, I wanted to ask you, as a clinical psychologist, a psychiatrist, what do you see that's happening out there when we are sort of trying to cancel all these things which allow us humans to sort of interact with each other, especially at times of, Thanksgiving and Christmas, or those times when we're supposed to get together, but we have government entities saying, hey, no, we don't want you to mix, stay away. So give us a sense of what is the ramifications of that type of stuff that happens in society.
Well, this is part of the 5 reasons why we shouldn't cancel Thanksgiving, and of course Christmas too. I'm seeing a lot of psychological dysfunction. I'm sure you are too. People are depressed, they're stressed, they're hopeless, they're feeling helpless, they're angry. There are so many things that are going wrong at this time. All having to do with taking away our liberties. And the excuse, of course, the universal excuse, is coronavirus. You have to have a lockdown because of coronavirus. You have to cancel Thanksgiving because of the coronavirus. I mean, it is really scary. I've been thinking about this more and more. And if you were in college and you were asked to write a paper, how to destroy the United States, this is what's happening. We are being destroyed economically. We're being destroyed psychologically. We're being destroyed, take our freedoms. It's George Orwell's 1984. We're being destroyed in terms of our freedoms. I mean, every part of our society, everything that we cherished and that we should be thankful for is being stripped away from us. In California, for example, they just announced, our wonderful governor in California, Newsom, he is such a hypocrite because he's been putting out all these mandates, since the pandemic began, and they change more often than he changes his underwear. And the latest one is he said that on Wednesday, all outdoor restaurants have to close too. Not only indoor dining, you can't do that, but now even outdoor dining. And that is the stupidest. People are doing things, authorities, so-called authorities are doing these things to try to, because they're overwhelmed by the pandemic and perhaps for more sinister reasons. So if you cancel outdoor dining, not only do you destroy the income of the restaurants and the people who work there and all of that, and of course you destroy the getting together, the enjoyment that we all need. We're desperate for some kind of enjoyment. Not only is that destroyed, but that will mean that more people will be going inside and congregating in bigger groups. Now, what I'm saying as far as don't cancel Thanksgiving, I'm not saying we should have, 50 people in our home for Thanksgiving. Whatever your Thanksgiving normally is or was going to be this year, that's what I'm saying you should do. And there are certainly healthy, safe ways to do it. We all know, obviously can't have a mask when you're eating at the table, but you can sit outside if the weather permits. You can put little tables all over your house and sit people 6 feet away from each other. I mean, there are different, then you can have the people who are older or otherwise have underlying conditions. You can bring them in by Zoom. I mean, we know these things and we can do these things. We don't have to cancel Thanksgiving.
Well, what is your sense in terms of where, example, like, they're issuing these mandates, for example, in Michigan, Governor Whitmer, she issued these mandates, but even the Supreme Court of Michigan struck it down and said that, the powers that these politicians are sort of saying that they have or usurping, the power, they don't have that, and they overturned their decisions. But the fact of the matter is that there still is a consequence that happens, as you were talking about. Give us a sense, from the clinical side. What are you seeing from some of your patients and whatever that are coming in there that may have been already somewhat depressed prior to COVID or because of this? And are you seeing, for example, that their situations are getting drastically worse? I mean, how are they coping with it? And children too. I mean, how are they coping when they see, mom and dad just sort of freaking out? Your thoughts?
Yes. Between schools being closed, not everywhere, but in the places where schools are closed, that is having a tremendous disruption on the family, particularly, of course, on the kids, who are developing all kinds of psychological problems, just like adults. I mean, they're like the child's version of it psychologically. But, anxiety disorders, depression, PTSD, eating for kids, eating disorders. Lots of kids are going into the medicine cabinets and the liquor cabinets of their parents because they're bored. There are all kinds of things like that. And for adults, of course, one of the things that got us through 9/11, helped us to heal, was social support. What that means is getting together with friends and family, colleagues, people who you care about and they care about you. You tell them your worries and you give them advice. You support them in whatever they're going through. It's an exchange. And that, of course, is the typical kind of thing that happens on the Thanksgiving table. And so, we're being beaten down more and more and more with these mandates. It's just, it's demoralizing, not only depressing, but demoralizing. And it is, as I was trying to say about if you had a college assignment to write how to destroy the United States, and I mean, maybe I don't want people to think that I'm a conspiracy theorist. I don't like to think of myself as a conspiracy theorist, but there are so many things happening, one right after the other, of course, not to mention even the election. We can spend the whole time on that. So many things happening one after the other. It's like you have to think that somebody planned these things. They couldn't all be happening in this order, in this way, by chance.
No, you're absolutely right. Listen, Carol, we've got to take a quick break here. We'd love to hold you over for another segment. Do you have time to hold on for us?
Sure.
Well, thank you. We're speaking with America's psychiatrist, Carol Lieberman. As I said before, she's a board-certified Beverly Hills psychiatrist, and you're watching and listening to us on the Conservative Commandos radio network and on the AUN TV broadcasting system in California. We can be seen on Roku. You can look at 247.com. Any of the social media platforms, but right now we are still a capitalist country, at least for a few more weeks, hopefully longer than that. But we've got to do some business with our sponsors, so we're going to take you stay with us until we come back on the other side with my co-host George Lambert, and I'm Dr. Nassar. We'll be right back in just a couple of minutes. Don't go away. We'll be right back with Dr. Carol Lieberman.
Are you paying too much for your health insurance? Are your deductibles too high? Or are you completely uninsured? If you answered yes to any of these questions, Healthcare Help Desk can help you now when people need help the most. Health insurance laws and rules have changed. If you have Obamacare, are uninsured, or your premiums are too high, call Healthcare Help Desk. It's free. New healthcare plans are available, and you may qualify for dental coverage and lower copays and deductibles. Make the free call now. Top quality coverage at the lowest prices anywhere. You may be paying too much and not even know it. In these troubled times, healthcare is more important than ever. Don't let another day go by without health insurance. Policies are being offered with very low copays and deductibles. So if you're uninsured, underinsured, or paying too much, call Healthcare Help Desk. Learn about your options before it's too late.
Call 800-964-1055. 800-964-1055.
Attention Medicare recipients and anyone turning 65. Medicare has approved new benefits not included with original Medicare and older Medicare Advantage plans. You may not be getting all of the benefits you're entitled to. These new Medicare Advantage plans may have many free new benefits including in-home aids, telephone appointments with your doctors, home-delivered meals and prescriptions. These benefits may be available and it's a free call to enroll. The easiest way to enroll is to call the Medicare Benefits Line, a free non-government service. The new plans may also offer free eyeglasses, free hearing aids, free wellness visits, and gym memberships. Call the Medicare Benefits Line now. It's easy. Find out if you're eligible for new benefits like meal and prescription delivery, in-home aids, and telemedicine. Some plans may have a $0 monthly premium or zero copays for big out-of-pocket savings.
Call 800-691-1655. 800-691-1655.
Medicare Benefits Line is not connected with or endorsed by any government agency or the federal Medicare program.
I owed the IRS $10,000.
The IRS garnished my wages.
They put a lien on my house.
I'm self-employed and didn't report all my income. They claim I owe a lot more than I do.
The IRS is the most powerful collection agency in the world. They do not give up until you pay.
I couldn't sleep. We were being audited. I called Tax Solutions Now, and a great big weight was lifted off my shoulders.
I called Tax Solutions Now, and they got the IRS off my back.
Tax Solutions Now had my wage garnishment lifted in 48 hours.
Tax Solutions Now can get you help. Our agents know the rules, can stop the pain, and get you the best deal.
Tax Solutions Now saved my business.
I qualified for the Fresh Start program. I paid less than I owed.
We connect you with a team of former IRS agents and tax professionals who get the IRS off your back. Time is running out. Call Tax Solutions Now.
Call 800-447-7570. 800-447-7570.
Welcome back to the Conservative Commandos, the radio show, the television show, of course, AUN TV Network, which stands for the America Uncensored News Network, and of course, the Conservative Commandos Radio Network. You can get us on our many broadcast towers. You can get us on iHeartRadio, and of course, you also have Al Gore's Amazing Internet, which brings you ccrshow.com, Roku, you name it. We're everywhere. Maybe not in China, North Korea, and Iran, but everywhere else, because I think they don't like freedom there, so we're probably not welcome. But everywhere else, we're there, and we're glad you're with us. We have been talking and having a great conversation with Dr. Carol Lieberman. She is a medical doctor. She is a psychiatrist and has just a tremendous amount of expertise in this in the medical field about how our brains work, how our minds work, how these things affect us. And my co-host, Dr. Nasser Sheikh, started off with some of those things. And I want to continue that conversation, but because I'm a lawyer, I might look at it just a little bit differently. One, I want to talk about some religious liberty. It seems to me that in America, faith is an important part of our lives. And not, you can be a person who doesn't believe and doesn't have any faith of any particular kind. That's fine. We allow that in our country. There's no punishment for that. But we've also always allowed people to be believers of whatever faith tradition, whether it's Judaism or Christianity, or whether it is Islam or Hindu. There's lots. I mean, America has as many different flavors of religion, as it were, as we do food types. I mean, that's because people come here for what reason? Because they want freedom, and maybe where they came from they didn't fully enjoy it, and so they came here. So to me, I guess the question is how does that impact us as a people to have some of these things start to slip away, or to have people tell us you can't get together with your family, these traditions that you've created that become a bulwark of family support systems?
Well, these things are unconstitutional. Certainly taking away the right to practice your religion. Now, of course, the way they are trying to get around that is by saying, well, you can practice your religion in your home, you can pray, to whatever God. But that's not the same thing, and that's really, not answering the question. To think, there's such randomness going on. I mean, such capriciousness. You can't go to church or to temple or go to a place, especially indoors, where you can practice religion together. But it's perfectly all right for protests to go on in the streets and to loot and everything else. It's what's so frustrating is that the mainstream media, when they talk about these things, they're so careful. They're talking about these same issues, and they're so careful to not talk about the protesters, right? No less the rioters, as far as being the source of most of this contagion. It's a few people sitting in a restaurant outside, or people sitting in your home if you practice, do it safely the way I was mentioning. That is not going to spread the virus. But people, meanwhile, walking in the streets and protesting, or even just like the Lakers, like when the Lakers won, there was this big, wasn't exactly a protest, it was a celebration, but all these people downtown in LA gathered together, maskless, of course, and those are the kinds of things that spread the coronavirus. So this capriciousness is really very depressing. Very, people look at that and they feel, they feel helpless. They feel like this is unfair, but what can I do about it? And religion is very important. That was another thing after 9/11. People flocked to the houses of worship to get spiritual nurturance, and that helped a lot. There were all these statistics about how many more people were attending services and so on. So taking that away is another way to sort of demoralize us.
Interesting. Now, I remember reading an article sometime this summer, and I forget which jurisdiction. I don't know if it was the United States or if it was California, but it wasn't like some small town. It was a large enough jurisdiction that the statistic was somewhat meaningful and scary. And it was something to the effect of, in that given month or 2 month period, they had seen, quote, a year's worth of suicides. In other words, there were a lot more suicides occurring. And I'm not a medical doctor. We've established that. But that sounds like that's not good for America's health. I think suicide is probably bad for your health, but don't take that from a lawyer. I'll let you speak to that.
Well, when the lockdowns came, not when coronavirus first came, but when the lockdowns started being mandated, that's when the calls to suicide hotlines escalated. And needless to say, as all of these things that we've been talking about have been continuing with no end in sight, then there's the vaccine, but that's a whole other issue about that. But, so maybe there's an end in sight. I don't want to be, totally depressing. But as far as the people getting drunk on power, and having all these mandates, there's not necessarily an end in sight for that. And so it's just people, you look around and think about how, do I really want, I mean, I know this is sad to say, but do I really want to live in this country with all the things that have been changing and that are going to change more if in fact we change presidents, which of course would be a total disaster. People are asking themselves that, do I want to live in a country where there are these things that we've just been talking about, in regard to coronavirus, and all the other things that are on the horizon, the defund the police, the no private property, not being allowed to own private property, all of these things that a portion of the potentially incoming administration want to enact. So, and all, like things, things that we have lost traditions. We need traditions, it's not just fun and so on, but it's to keep us oriented to our life. It's a security blanket. And in regard to Thanksgiving, having this time to be together and to think about all the things that you can be thankful for. I mean, because of all the problems in the world right now, people need to actually have the intention of finding things to be thankful for. Some people will say, oh, what do I have to be thankful for? But so you have to really concentrate on that. And doing that is very helpful, especially when you have kids involved, because that can start off another tradition of every day doing the ritual after Thanksgiving, thinking of all these things that you have to be thankful for. And it's so important to do that for your mental health, because that, people just take a lot of things for granted, but when you start listing them, that is so helpful for your mood and to give you more optimism.
That makes a lot of sense. I have noticed in my life, and I've seen people that, in my opinion, had difficult, challenging lives, and I occasionally caught myself wondering how they could possibly be happy. And yet I found some of them, at least, were very grateful people. And I remember once or twice there was somebody I offered some help to because I thought they're having such a challenging life, and they were so grateful. And they, but what I'm getting at here is, because of their gratitude, they actually did not see their life as hopeless as it appeared to me that it was. Yes. And what it told me is there's actually power in gratitude. That gratitude gives you the strength and the power to overcome things that could otherwise be bleak. And I've heard some religious people make that statement, but I'm wondering if you would agree, because your article suggests that might be true scientifically, that gratitude is actually a really empowering, helpful thing. It's not just manners. When I was a kid growing up, my mom would always say, make sure you say thanks to to Bobby's mom when you leave. And I always thought of gratitude as being good manners because I didn't want to embarrass my mom. And then as I've grown older and started to understand the value of it is, my mother wasn't teaching me good manners. She was actually teaching me how to be happy and how to be resilient. And I just wasn't smart enough as a 5-year-old to understand the lesson. But I'll let you kind of hit that, and then I'll ask people how they can follow your work.
Well, yes. Depending upon whether you believe in this or not, and this isn't any particular religion, but it's just if you believe in the universe, like the power of the universe in general, that there is a power out there that you can call upon, the more grateful you are, like particularly, people are having trouble falling asleep. So if when they lay down to go to sleep and they are worrying about all different things, if they start listing, instead of counting sheep, if they start listing things that they can be grateful for, that they are grateful for, that will not only make them feel better and put them to sleep, make them feel peace, but it will also attract things in the universe to them, because in a sense that the universe feels that you are grateful for the gifts that it is giving you, and it attracts more. Now, I know some people are going to think that's kind of airy-fairy, but try it and see if it works.
Yeah, and my faith tradition tells me that would work. But our time is up. So, Doctor, if you would just tell us how our listeners and our viewers can follow your work and be up on all things Dr. Carol Lieberman, that would be great. Because, they need to get some of this good information all the time?
Sure, I appreciate that. I do a radio show on voiceamerica.com, a podcast radio show. It's called Dr. Carol's Couch. And then I do a second one called The Terrorist Therapist Show. That's a podcast. It's wherever you can find podcasts, and it's also on the RenegadeTalkRadio.com website. And I have websites, drcarol.com, which is drcarole.com. Those, and then of course you mentioned my books. So.
That's right, Lions, Tigers, and Terrorists. Oh my. Yeah. So that sounds like a good book to help your kids understand how to deal with those things. So thanks so much for spending this time with us. We really appreciate it. We do want to, because we're up against the break, tell our viewers and our listeners, this is the Conservative Commandos. I'm George Landreth. He's Dr. Nasser Sheikh, and we will be right back.
Everybody wants cheap airfare, but where do you find it? You call low-cost airlines. Their prices are direct from the airlines, and they're so low you can't find these fares published anywhere. They specialize in cheap flights, discount hotel rooms, cheap car rental rates, and great package deals anywhere around the world. Wherever you want to go, they can help you get there cheaply and with a best price guarantee. If you want the lowest prices on your airline tickets or other travel services, call now. That's right, call. That's the only way to get these rates. Experts are standing by 24/7 to get you the cheapest airfare and hotel rates available. So don't wait. Call right now for the lowest travel prices anywhere and for great last-minute travel deals too.
Call 888-431-0562. That's 888-431-0562. 888-431-0562. 888-431-0562.
Dish TV is better than cable TV. Here's why. Dish has the nation's lowest TV price, along with an award-winning DVR that can skip commercials, record 8 shows at once, and get access to thousands of movies at your fingertips. Cable simply can't even compare. So the smart choice is to cut the cable and get Dish. Plus, you get all these great TV features, free HD DVR upgrade, free installation, and free movie channels. Say goodbye to cable and get more with Dish TV. 877-290-7764, 877-290-7764. As an added bonus, you can switch to Dish now and receive a $50 Visa gift card. So call now and get Dish TV. Call 877-290-7764, 877-290-7764. That's 877-290-7764. Limited time offer, 24-month commitment and credit qualification required. Cancellation fee, monthly equipment fees, and other restrictions apply. Promotion can change at any time.
Friend, do you remember when it felt good to withdraw your cash from the bank to expand a business, go on vacation, or buy a new car? Well, today, withdrawing your own cash has become a very risky business, according to The Secret War, a shocking new research report. I just read it. And folks, I was amazed to learn why banks are now required to spy on us for the government and then report any suspicious or unusual behavior. I suggest you get The Secret War free. Just call the number on the screen, no charge, from the folks at Swiss America, and get this. Did you know simply spending cash today may be enough to have you branded as a potential criminal? That's right. The new war on cash is really a war against all freedom-loving Americans. The Secret War is yours free, so call the number on the screen and you can tell them Pat Boone gave you the number.
Welcome back to the Conservative Commandos, the radio show and the television show. Thanks to the AM and TV network and the Conservative Commandos radio network, and of course Al Gore's amazing internet. Our website, ccrshow.com, is the place to go if you missed any of our segments here, because we had some really great ones. And in fact, I should ask you to thank our guest and to tell everyone, Dr. Nasser, how they can follow you.
Well, thank you, George. First of all, if they want to follow me, they can go right to the website. That's Dr. my name, NASIRSHAIKH.com, drnassersheikh.com. You can go to Twitter, which is @Nasser Sheikh Show. That's Nasser Sheikh Show, or the YouTube channel, which is the Dr. Nasser Sheikh Show. And on Facebook, also the Dr. Nasser Sheikh Show. I want to thank our great guests that we had today. First, we had Dr. Jane Orient, the president of Doctors for Disaster Preparedness. We also, our second guest was Robert H. Knight. He's a Washington Times contributor, and he was talking to us about how Democrats are calling for unity, but yet they vow vengeance. And finally, we had America's psychiatrist, Dr. Carol Lieberman. She's a board-certified Beverly Hills psychiatrist, and she was just talking to us about why we should not be forced to cancel Thanksgiving. So, great guest. And George, how can they get a hold of you, our listeners and viewing audience as well?
Well, fair enough. It's pretty easy. My website at Frontiers of Freedom is ff.org. You can follow me on Twitter at glandrith. It's Landrith for the Landrith part of that. And then on Parler now, it's just the real George Landrith. Again, same spelling. So those are the ways to get a hold of me there. But always enjoy tremendously doing the show with you, Nasser. It's a pleasure. I always like the optimism, and but we are out of time. We've got to run. We've got to go. But I do want to say to our listeners and viewers, we will see you tomorrow on TV and radio. God bless.